So now, we would like to proceed to our next talk or next topic for this morning, and that is all about the first aid. Of course, dahil alam na natin kung ano yung mga types of hazards dito sa Philippines, dapat alam din natin kung ano yung mga first aid na maaari nating magamit sa panahon ng pangangailangan. And of course, yung first aid, kinakailangan nating malaman kung kailan ba natin pwedeng ma-apply ito. And with that, let me introduce to you, or allow me to introduce to you our next speaker for this morning. So she is a faculty of the College of Nursing, a BSN, SN, Level 1 coordinator, and a GOD coordinator. So, let's welcome with a virtual applause our next speaker for this morning, none other than Professor Phoebe Lynn Calungsod. So, a round of applause, everyone.
Good afternoon, good morning, sorry, but good afternoon. Good morning, Ma'am Erna.
Good morning, Ma'am.
So, in behalf of the College of Nursing, Dean Joel assigned me this task to discuss with you about first aid. So, can I share my screen?
Yes, Ma'am.
First aid. So, I'm tasked to discuss about first aid. So, what about first aid? So, the audience are students, first-year students, CWTS students. So, with this, for our learning outcomes or objectives for this talk or for this webinar, to be able to discuss the history of first aid, just a few slides or one slide. We'll have to define first aid and its type. We'll be able to identify who are the first aider and its difference with an appointed person. Then we're able to enumerate the common 10 first aid tips that everyone should know, meaning everyone should know lahat, no? So lahat, adult, no? This would be for adult like these first-year students. Then we'll be able to enumerate, determine the laws related to first aid, just a few, and then we'll be able to identify COVID-19 related first aid intervention awareness. Konti lang kasi pandemic ngayon, so iba talaga yung first aid if we have this virus with us. Okay, so next slide. Just just a little bit, alam nyo naman to, di ba? About this Republic Act na 9163, ito yung NSTP, and this CWTS is one of those component ng NSTP, right? So it's our responsibility of all citizens to defend the security of the state, and in fulfillment thereof, the government may require each citizen to render personal, military, or civil service, no? At iyan ng isa sa mga role natin, first-year students, CWTS students, no? Okay. Tayo mag-move ng aking slide. Happen. My slide's not moving. So when we say civic education, ito yan, di ba? Ang role ng CWTS, Civic Education and Defense Preparedness Program. At dito pumapasok yung preparedness natin. Since the theme for this webinar is all about disaster risk management, and one of the cycle of the disaster management cycle is about preparedness, no, and mitigation, no. So dito pumapasok si first aid. Okay.
Excuse me, ma'am.
Yes.
Excuse me, ma'am. Ma'am, medyo putol po yung PowerPoint presentation niyo po. Parang half lang po yung nakikita. Visible po sa end, ma'am.
Sorry. How about
Yeah.
that one?
Okay. 3/4 lang to be exact.
Sorry.
Okay.
Sorry. Just tell me if my my prob. Bakit ganun? Hindi
Okay. I think, ma'am, there's something wrong with paano ba
Yan.
to? Kayo na may okay, ma'am. Okay na po siya.
Yan.
Okay po, ma'am. Okay na po. Thank you po.
Sorry. Okay. So, ayan. So, again, balikan natin konti. I believe may mga waray-waray dito, no? Kaya kailangan magtagalog. First year students, same with my students. No, I cannot really speak in Kankana or Bisaya because I have students na waray-waray. Hindi daw nila masyado maintindihan yung mga deeper na mga terminologies ng Bisaya or Kana or Cebuano. So I have to speak in Tagalog, mixed Tagalog English. So yan. It's our responsibility as students, first year CWTS students, no? Kasi part yan ng civic education natin, preparedness program, no? At saka in line with the theme about disaster risk management, that we need to be prepared. No? Kung nandyan na, so I'll give you the next slide. So in relation to the disaster risk management, are you familiar with this one? This one is the disaster risk management continuum or the cycle. So saan tayo dito? Ayan. Dito tayo sa so prevention, bago mangyari yung disaster, prevent, tapos mitigate, malesen yung effect ng disaster. Then here, dito na tayo sa preparedness. So we need to be prepared. And prepared through training. No? Kung gusto nyo mag-train bilang isang first aider, later i-discuss natin anong difference ng isang CWTS student na who will respond. Ano lang kayang gawin? Can you call yourself as a first aider or not? No? And then here, are you capable or are you capable? Are you well trained enough to be a first aider? Dito na sa kung may disaster na, may sakuna na, may ano ka ba dyan, no? Is it your responsibility? O baka mamaya andun ka sa kulungan papunta, no? So we'll discuss that one because not all can be called first aider. Okay. Yan. So next slide. So there are, ito kasi pinasok ko lang this morning kasi yung kahapon yung ginawa ko yung slides ko. It's all about really first aid. And then this morning, I just saw that it's about in relation to disaster preparedness, yung first aid. Kaya ito pinasok ko. And then here, there's the 4 steps of disaster preparedness. Identify, which is si Sir Seno kanina, nag-discuss. Then you develop a plan. Then you implement and train. So baka dito tayo na belong or part of this, being part as a leader of your community, no? Yan, baka dyan kayo na belong. So next slide, we have just a brief history of first aid. So nung unang panahon, kailan? So 18th century pa nag-start yung first aid. So sino ba? No? Ang alam nyo pag sinasabing first aid, Red Cross, right? So, ayan. So, 18th century, 1879, si St. John Ambulance. Kaya, siguro tinatawag siyang, ambulance yung mga, di ba natin, yung mga emergency car ambulance dahil siguro dito, di ba? Was the first to use the concept of first aid in the United Kingdom. So, Princess Christian, the daughter of Queen Victoria, translated from German into English, 5 ambulance lecture. So sino ang nagbigay? Ito na yon si Professor Friedrich S. March, which were published under the title First Aid to the Injured by Smith and his partners. So by then, St. Andrew established the first aid organization in Scotland to alleviate the pains to alleviate the pains of the injured and patients in wartime and peace, and to take measures required to their care. So dyan nagsimula kaya, no, yung first aid. Okay. So sino naman, no? Sino naman ang wait. Next. Okay. Mga religious group kasi sa 18th century, sila yung nagre-respond ng mga emergencies. See that picture? Mga first aid pioneer. Si Dr. Matthew Shields, ayan sila. So doon na yung Red Cross, Industrial First Aid. Ba't ayaw siya? Okay, sino naman to? Siya si Clarissa Harlow Borton. Since I'm also a nurse, share ko lang kasi. I know I have students here, first year students. You can raise your, put some heart there, no? I think meron akong students dito. So Clarissa Harlow Barton was an American nurse, although hindi siya formalized talaga na graduate ng degree sa nursing kasi hindi pa na-formalize yung nursing noon. She was a hospital nurse in the American Civil War, at the same time a teacher and a patent clerk. So siya yun ang nag-discover ng first aid. Okay. So, ano ba ang first aid? What is first aid? So, alam niyo naman siguro, first aid. Pinakaunang lunas. Okay. So, it is the first response or treatment given to someone who has been injured. Yan. Pwede rin siya. It refers to the emergency or immediate care you should provide when a person is injured or ill until full medical treatment is available. So, kaya, are you ready? Kung ikaw, no? Kung ikaw, wait, okay? Isa ka dito, you will be appointed as one, no? Who will respond if ever may sakuna, may disaster. Kaya mo na, no? Kaya mo na ba? For our students, first years, I don't know, you have experience or you have trained to any sa inyong locality, sa LGUs, because there are LGUs, no, na nag-organize ng mga training about first aid. So maybe some of you, no? Okay, so there are different types of first aid. Ladies and gentlemen, so hindi lang isang klase ang first aid. Pwedeng may nasabi natin emergency first aid. So ano naman itong emergency first aid? It includes the content for basic first aid involving life-threatening injuries. Ang tanong natin later, no? As CWTS student, first year student, capable ka ba to do the emergency first aid? So focus on the airway, breathing, and circulation emergencies and prevention of such. So, kaya mo ba to? No? So, if you're just an ordinary student na walang training, certified na training, hindi emergency first aid, no? Ang pwede sa'yo. Okay? So, this course comes with CPR, no? Trained ka talaga sa adult skills or sa child or sa infant na CPR. Ito yung emergency kaya it's a matter of life and death, no? Airway, breathing, and circulation, may bleeding, mahirapan huminga, no? Barado, no? Dito sa bibig, yan. Emergency. And the next type, okay. And the next type is your standard first aid. Tanong, no? Eto, pwede ka ba dito? Required by most employers, preferred by parents, all content of the emergency first aid is covered, as well as wound care, head, neck, and spine injuries, and more. Now, tanong, again, kaya mo ba to? As first-year students, as CWTS students? Yes, pwede. Kaya natin tong standard first aid. Pero later, i-discuss natin kung hanggang saan. Okay. Meron din namang ibang klase ng first aid, child care first aid. So when we say child care, so sa child siya, covers the content for standard first aid plus additional content for child illness and safety. All about, tingnan niyo yung picture, yan, sugatan, yung all about child care. Then we have another type, babysitter course. So it's like na babies. Ayan. Ano mamang mga pwedeng mangyari sa baby na kailangan ng first aid? Yan, mga nahulog, choking. Yan. Ayan, poisoning. Yan, kinukuha yung mga yan, muriatic or whatever sa bahay. Then we have another type, home alone course. No, designed for kids staying home for a short period of time. Alam niyo na, tingnan mo, may baril. Oh. Focus is on safety, responding to emergencies. Yan. Yan ang limang yan, ang different types of your first aid. So, sorry, may isa pa pala, sorry. This is new, especially now na pandemic tayo, may tinatawag din tayong psychological first aid. It's not only the physical thing, the most important also is our psychological first aid. So it's a resiliency building wellness program that equips individuals in supporting themselves and others to cope with the effects of stress, loss, trauma, and grief. And yung time din sa panahon ni Hayan, ni Yolanda, a lot of volunteers, mga psychologists and other psychological first aiders who help those victims sa Yolanda. Yan, psychological first aid. Mayroon ding training yan. So in order for you to become a first aider, pertaining to the psychological concerns of a person, tinitrain ka po. Okay? Yan. Okay. Now, tanong, are you a first aider? Okay? Are you a first aider? You can type, first aider ka ba? Ano kaya? Tama ba yung sagot nyo? Tingnan ko. You can type there, yes or no. I will see. You can type sa chat box. If you're here in Zoom, and if you're in the and you're in the Facebook Live, you can just type, are you a first aider? Yes or no? Tanong, first aider ba tayo? May mga sagot pa? I see. No. No daw siya. May magsabi bang yes? No daw. See, some more answer please. Buhay pa ba kayo dyan? Answer please. No. No daw. Okay, tingnan natin kung no ba talaga. Okay? Kasi ma'am, based sa yung sinasabi mo kanina. So some of the, for example, sa isang lugar sa US kasi ito sa mga developed countries, nakalagay na talaga doon nakasulat, for example, for a certain community, na-identify nila kung sinong first aiders, may mga name, may mga location, para kung in case of emergency and in case of disasters, alam nila kung kanino pupunta. Ayan, may name, may telephone number. Yan. I don't know here in the Philippines. Hindi ako sure. Okay. Siguro for a certain office siguro meron, or sa university, like dito sa VSU, meron tayong usher, They are the ones who will respond, to any emergencies. Okay? So, what is a first aider? It is someone who has undertaken training, take note, training appropriate to the circumstances. Okay? They must hold a valid certificate of competence in either first aid at work, emergency first aid at work, any other level of training or qualification that is appropriate to the circumstances. Yan. So, tama ba yung tagot nyo? Are you a first aider? Sabi nila, no. Okay. So, first-year students, soon to be, you will become nursing, first-year nursing students will become a first aider soon because we will train you. Second year, dati pag face-to-face, we will train our students, sa Red Cross for first aid training. Okay. So first aider is someone who has undertaken training appropriate to the circumstances. And there is also what we call appointed person. For a certain office, a certain company, or a certain industry, merong tinatawag na first aider, meron ding tinatawag na appointed person. So sino naman to? Anong difference ng both, Ito si first aider, qualified, certified. Yan, But ito naman, si appointed person is someone who is nominated to take charge of first aid arrangements, such as looking after the first aid kit and calling an ambulance in an emergency. Doesn't have to be trained itong appointed person. Pwede siya somebody head of the office or head of the family, even sa inyo sa bahay nyo, 'di ba? Sino ba yung appointed person nyo sa bahay na just in case of emergency, siya yung nag-look out na sa yung first aid kit, no? During those experiences that you had with Yolanda, meron ba kayong appointed person sa bahay or talagang kagulo-gulo na lahat saan na pupunta, no? So after this one, I hope that it will be your take home, no? Na learning that sa bahay nyo, kung marami kayo, no? You will have to appoint someone, no? Na siya yung ang mga ilaw, no? Mga pagkain. Dapat may go bag kayo, no? Sa bahay. Na siguro naman narinig nyo yung sabi ni Sir Seno, no? Na yung mga hazards na possible na mangyari dito sa Region 8. No, yung sa earthquake, yung 'di ba? No? So dapat mayroon tayong go bag. Okay? Andun lahat. So dapat may appointed person. Ano namang responsibilities ng both na 'yan, no? The differences. See? Appointed person here, then we have the first aider here. So itong mga check na to looks after first aid equipment. Pwede sa yung dalawa, appointed person and first aider. Take charge when someone is injured or becomes ill. No, pwede yung dalawa. Calls the emergency services. Pwede yung dalawa. Make an initial assessment of injured individual, injury or illness. Hindi pwede si appointed person. Dapat yung trained talaga siya, no? Somebody who is trained, somebody must preference if medical course, no? Ang yung tao na yan na member ng family or member ng office niyo or sa company, mga company nurses, yan. Then gives appropriate first aid to the casualty until help arrives. So dito sa BSU, pupunta na kayo, we have usher. Sila yung mga first aider natin dyan, no? Then maintains injury illness records as required. Or sa members sa yung family, maybe may mga nursing students kayo na mga higher level, no? Years second already trained to do the first aid. I think before kasi nag-train din sila sa what's this, RO? I don't know sa RO ba yun? Because I noticed before yung mga fourth year namin ngayon, they are trained, by the I don't know, CWTS or NST, I don't know, ano ba yun? Basta train sila that. Okay? So, hopefully, kung mag face-to-face na tayo, pwede kayong i-train. Okay. Then, next. So, who? Sino ba? May criteria ba yan? Kung sino ang karapat-dapat na maging first aider or appointed person. Dapat may qualifications yan. Dapat may willingness, no? Dapat ano kayang personality, no? Is he or she reliable? May ability ba siya? Okay. So when we say willingness, it is something the person can enjoy and take pride in. So wag kang mag-appoint ng someone, to be trained or being appointed person kung hindi naman siya willing. Mamamatay lang kayo, walang magagawa. In case of emergency and disaster. Yan. How about the personality? Hindi yung ratulon, Wag yung mga nervyosa, nervyosa. Are they calm and confident enough to cope in an emergency? Baka nauna ng nervyosa lahat na, it's very contagious. Once member of the family, nervyosa lahat na, magnenervyos na lahat, Dapat somebody who's calm and confident enough to cope in an emergency. Okay. Somebody who is reliable, will they be available and easily reachable in a crisis? Yan, reliability. As I said, pwedeng sa family, pwedeng sa barangay nyo, or sa compound nyo. Yan, And ability. Are they physically able to carry out the procedures? Baka yung inassign nyo dyan, PWD, Okay, so dapat may ability. Okay. So here, ito na tayo. Time is at 11:23. I hope I can finish. These are the first aid tips that everyone should know. Ito yung highlight ng talk na to. What you should do in case of emergency. Now, as we have said, si Sir Seno sabi, pag emergency pa, kaya pang solusyonan. But if it's really a disaster na, wala na, kailangan ng help outside na. Kung first aid lang, kaya natin. If for example, nandito na kayo sa campus and we have this emergency na kaya pa ng usher natin ng BSU Hospital, din kakayanin. But if not, kailangan na ng services nyo, kailangan na ng tulong ng mga CWTS students, no? Don't hesitate to help, no? Kasi kayang-kaya nyo to. Ito yun, first aid tips. 10 lang to. Okay? Yan, 10 na yan. Didiscuss natin isa-isa. Okay? So, to 12. Okay. So first, number 1, what you should do. Please remember the 3 P's. 3 P's. So para madaling, in case of emergency, para madaling ma-recall. Ano yung sinasabi ni Ma'am Phoebe na 3 P's na in case of emergency na kailangan yung service mo? You need to think about preserving life, prevent worsening, and promote recovery. Ayan ang tandaan lagi. Ladies and gentlemen, na do what you can, save the person's life. Okay? So gawin ang lahat, ma-save lang yung person's life. Do, what you can to keep them for sustaining further injury. That's the second P. Para hindi mag-worsen. May nakita kang, you're suspecting for a fracture and yet binuhat mo, ayun, nabali na. Instead of okay pa yun, medyo sprain lang or medyo pa lang yung fracture niya, but binuhat mo, prevent worsening. Ayan, do what you can to help them heal, promote recovery. Okay, ayan yun. So as a first responder to any situation, your first priority should be to preserve life. Airway, tingnan mo dyan, airway and breathing. Paghinga ang importante. Okay? So, what you will do, kung hindi ka trained for a CPR, then don't do that. Stop bleeding. Kaya mo naman siguro i-compress, Pag may bleeding dito, kaya mo siyang i-compress here, to preserve life, Alam mo, pag sobrang wala ka ng dugo, hypovolemia or hypovolemic shock, will occur. It is a life, threatening situation. And then start with CAB, circulation, kung may bleeding, then airway, then breathing. Okay, baka may naka-choking, baka may naka-ano lang dyan sa bibig, kaya mo yan, later. Kasi dito puro lecture to, so I will not teach you the skills, just an overview about first aid. But if you want to go more, we can do that soon, Yan, sa mga skills yan. Okay. So assess the quality of the victim circulation, adjust if needed. Ayan yun sa preserve life, Okay. Do what you can. Prevention, worsening, do what you can to keep the victim in stable condition. So, naka-stable siya. Pag suspect ka ng fracture, medyo na-twist yung kamay o paa, hayaan mo siya dyan. Stay with the individual, stay with the person, and then let somebody call for help until the help will arrive or medical professional will arrive. The goal here, the purpose here, is to prevent the condition from worsening and prevent any potential injury. Okay. Or nasa heat, Nasa heat. Okay? Nasa ilalim ng sun. So, put the victim in a safer location. So, pwede mo siyang okay naman yung physical upon your assessment, okay naman. O pwede mo siyang payungan. Ilagay mo siya sa area na may shady area, So, ayan yung prevent worsening. Or just staying with the victim and provide comfort. That would be enough, Psychological comfort, It means a lot. Kaysa yung victim nandyan, walang somebody, So then, promote recovery. So after you've done what you can do with first aid treatment, your job now is to promote recovery. So, you encourage confidence, provide comfort, attempting to relieve pain, and so on. So, ayan yung 3 P's: preserve life, prevent worsening, and promote recovery. PPP. Okay. Ayan, inano ko na yung mga activities ha, kasi ninadali ko na siya. Okay? So, ayan yung mga sample. If you want to ask for my barparbad, I can give it to you. I can give it to your coordinator. No? Baka may mga exams kayo. Yeah, I can share it with you. Okay? No worries. Ayan yung mga activities. Ayan. And there are also what you call 3 C's on first aid. No? Ito din ang isipin nyo, aside from the 3 P's na yan, we also have 3 C's. No? Check, call, and care. Okay, what about checking? Checking for anything unsafe, pwede mo, no? If the emergency is surrounded by danger, assistance may be needed, no? Rushing into a scene without taking in present danger may lead to more harm. Kaya i-check mo. Baka may nahuhulog na dyan ng mga debris, no? Ayan. For example, if there are car wreck happens in a high traffic area, or if there is someone in need of help in a fire, you will need to check or to seek assistance. So check scene first if it's safe. Okay, I think that would be the job for the next speaker about safety. Then call. So in emergency situations, you have marami akong nakikita ng mga emergency numbers now na nag-pandemic, mayroon talagang nakalagay everywhere. I don't know with your barangay, but as far as I observing, marami even dito sa university or sa baybay, sa city baybay, mayroon talagang nakalagay na mga, or sa website, or sa Facebook page, may mga emergency numbers. Call so that, importante talaga may load kayo. Call kayo, tapos wala pa kayong load. So it's not really advisable na zero load. Dapat may means of communication. And of course, care. After checking the scene and calling for help, provide care until medical professional arrive on the scene. So you need to monitor, so to take care of the individual. Okay. Or we need to stop the bleeding by compression. Okay. Number 2, check the scene. Ito yun yung kanina, CCC. Ayan. Before you provide help, to an injured person, it's important that you check the scene for danger. Kailangan talaga yan, okay, for safety. More of that sa next speaker natin for the checking of the scene. Next, number 3, treating cuts and scrapes. Paano? Tingnan mo yung kamay dyan. Tingnan mo yung kamay niya. Okay. What you will do? Wait, ayaw na mag-play. Okay. Blood is a vital component of our bodies, of course. Blood is the river of life. Without blood, we are nothing. Wala tayo dyan, When someone is bleeding, you want to prevent as much from leaving their body as possible. Kasi sa blood, doon kinukuha yung oxygen natin, mga nutrients natin. Pag walang dugo, patay tayo. Okay? So, yan. So, sa katawan natin, ladies and gentlemen, meron tayong iba-ibang blood vessels. We have the arteries, yun yung pula. Diba? Siguro may anatomy and physiology kayo, even when you're still in elementary. Merong veins, yung blue, and then merong maliliit yung capillaries. Now, pag sa arteries yung nakat, where we have ang laming arteries sa katawan, mostly mga malalim na to yung arteries except for the radial artery, ito yung superficial. Kaya ingatan natin, yung gusto nyo magpakamatay, dito na, may major artery dyan, kaya diretso, patay kayo dyan, So, spurting of blood. Pag nagsuspurt ang blood, like this one, ayan, nagpo-pulsate yung flow, bright red yung color. This is very dangerous kasi artery yung nakat. Okay? So, kailangan mo talaga i-compress right away. But if steady lang yung flow, slow lang ang flow, at saka dark red in color, hindi masyado siyang, pero it's still bleeding, veins. Ito ang delikado pag artery. Pag capillary RAM, konti lang, slow and no, yung flow niya slow lang. So what you will do, kaya natin to. Try and find a clean cloth or bandage, clean. Kung nandyan ka sa scene, pinaka-clean sa palagay mo. Dapat presence of mind talaga, yun gamitin mo. If you will use your shirt, pwede, no? Your socks or whatever, no? Apply gentle pressure for 20 to 30 minutes. 20 to 30 minutes. Then, clean the wound by gently running over it. Avoid using soap or on an open wound, especially if deep yung wound. Then you can apply antibiotic, no? To the wound like Neosporin. If it's a vein or capillaries lang, pag arteries, nagsusport talaga. Pag walang blood clot, matagal yung blood clot, may condition si patient or si individual, matagal siya nagpo-blood clot pag nasa arteries talaga yung cut, no? Cover the wound with a bandage. Okay? So, yan. Nose bleeding. Bleeding pa rin to. Yan, which is common, especially pag mainit yung panahon. No? Ayan. So, what you're gonna do? Lean forward lang. Huwag mong pa-lean back. Kasi maano yan, papunta yung lungs, yung dugo. No? Delikado pong papunta sa lungs. Just lean. Have the person lean forward. Press a cloth against the nostrils until the blood flow stops. Or if you have eyes, ayan, X to ha, huwag ganyan pag may nosebleed, ganyan. Okay? Pag may eyes, pwede sa nose bridge dito lagay yung eyes. Pag wala naman sa scene, ito, kayang-kaya na to. No? You just have to press. No? To prevent, no? To stop the bleeding. Ayan yung mga ginagawa nila. That's 3. Okay. Next. Deep wounds, ito yung mga malalalim na sugat. Ayan o, malalalim. So just have to apply pressure. Don't apply any ointment, Cover the area with loose cloth to prevent contaminants from infecting the wound. Kasi pag deep yan, diretso na yan dun sa blood vessels, sa bones, dito na deeper, no, part of our body, which is delikado siya once, no, mapasok na siya dun sa system, no? Sa system natin kasi pag nagdala yan ng infection or yung mga microorganisms, no? Patay tayo dyan. Seek medical attention as soon ASAP talaga, no? So you need to seek medical attention. Ito yung gagawin mo lang una. Okay? Kung nandun ka sa scene, kaya mo yan. Kaya natin yan. Right? Okay. Next. 4th. What condition? Treating sprains, strains, or twist, is a sprain, is a stretching or tearing of ligaments. Medyo, yan, pamangkin yan, no, si strain, or na-twist lang konti, ayan, no? So, hindi masyado. Okay. So, keep the injured limb elevated. Apply ice to the injured area. Then apply ice directly to the skin. Wrap it in a cloth or put ice in a plastic bag. Hindi diretso yung ice lagay, ha? Not directly. Ibalot mo siya, no, ng cloth. Okay? Keep the injured area compressed. Compressed mo siya. Put in a brace or tightly wrap it. May mga bandage kung mayroon kayong bandage sa first aid kit nyo. Don't wrap it so tight that it will cut off circulation. Huwag naman masyadong, no? Huwag masyadong mahigpit. Okay? Hindi yan makahinga. Just like, no? Just like your boyfriend and girlfriend. Huwag masyadong higpitan kasi hindi yan makahinga. Diba? Choke. Okay, off yung ko. Ice for a while, then compress, repeat at intervals. Ayan, in other words, nandyan yung sa kabila, first aid for sprains, strains, and twists, no? Take note of rice. Kanin, o diba, malapit na mag-12. Rice stands for rest. Rest mo siya, no? Rest the injured area for 48 hours. That's basically 2 days. Okay, huwag mag-basketball agad. Na-sprain ka, tapos kinabukasan basketball ulit. No. Rest it for 48 hours. Ice. Ice for 20 minutes at a time, 4 to 8 times per day. So may siya, no? May interval siya. Okay. Then compression. If you have bandage, no? Elastic bandage, you can do that one to help reduce swelling kasi mamamaga talaga yan. Then you elevate. Elevate the injured limb 6 to 10 inches above the heart level. So elevate mo siya ng unan, pwede kang nakahiga, basta elevated siya. or nakaupo ka but naka-raise siya, no? Naka-incline ka, basta above the heart level. Okay? Yan. Same din kung may bleeding, above the heart din, no? So, ano mo yan sa taas. Okay. Kayang natin yan. Kayang-kaya natin yan. Okay? We don't need an expert to do that, no? Professionals to do that. Okay? Then 5, treating heat exhaustion dito, no? Sa atin sa Pilipinas, ayan yung mga simptomas, no? Na you are, no? Maybe you're suspecting for a, no? Heat exhaustion. Cool, moist skin. Huwag naman yung heat, no? Mga, no? At mga atake na dyan, no? Mga exhaustion lang muna, medyo mainit, heavy sweating, dizziness, weak pulse, muscle cramps, nausea, and headaches. Pag nandyan yan, you're suspecting, at saka yung factor na expose siya sa sun for longer time, ayan, baka heat exhaustion yan. So what you need to do, ayan, ilagay mo sa shaded area. If there are no shaded areas available, keep the person covered by any available materials that can block sunlight. Yan, give the person water and keep them hydrated. Place a cool cloth on their forehead to lower their body temperature. Yan, pwede yung gawin. Ladies and gentlemen, ayan no, pag extreme heat, beat the heat. No? Sino mga tao? Okay? Sino? No, sino mga children, the young, the old, mga vulnerable yan, mga PWDs, yan, mga outside workers na exposed sa sun. Yan yung mga no, prone to this heat exhaustion. Yan. How to avoid? Stay hydrated. Drink more water. Water talaga yung ano niyan, solution. Okay, next 6. Malapit na tayo. So it's 11:40. I'm taking note of the time. Okay? Ito, kung taga-Amerika kayo, may hypothermia na nangyayari. Ano yung hypothermia na yan? Extreme, kung kanina extreme increase sa temperature, ito naman, no? Lowered naman yung temperature. So, ano mga symptoms? Shivering, slurred speech or mumbling, weak pulse, weak coordination, confusion, red colored skin, loss of consciousness. Are these applicable in the Philippines? No, we'll just have to mention na lang kasi yung source ko, it's outside the country. Kaya yan nilagay si hypothermia, no? Be gentle with the afflicted person. Don't rub their body and don't move their body into a jarring of a way. This could trigger cardiac arrest. No? Be gentle talaga. Move the person out of the cold and remove any wet clothing. Cover the person with blankets and use heat packs. Okay? But be careful for the heat packs. Baka masunog. No? So at the same time, yung ice kanina, balutan ng cloth. Same time kung hot heat packs, balutan ng cloth before ilagay direct sa skin. No? Don't apply heat directly to the skin because major skin damage yan. Give the person warm fluids. It's raining here. Just tell me if okay pa yung signal ko. Kasi it's a fact na pag umuulan, yung signal, no, humihina. Ayan. May tinatawag na hypothermia wrap. Ayan. Yan yung intervention. Then 7, treating burns naman. Yan. So may iba-ibang degree ng burns, ladies and gentlemen. May 1, 2, 1, 2B, 3, 4, depende kung gaano kalalim. Kung superficial lang, kung medyo malalim, at saka super lalim. Ayan, may degree. Okay? So first degree, second, third, and fourth degree. Medyo malalim na talaga. Okay? So, what you will do, ayan. If it's considered mga first degree, second degree, minor lang, no? Even mga third degree, makonsider na part of the third degree, makonsider na yan na major burn. So if it's just a minor, nakablister lang dito, no? Run cool water over the afflicted area. Avoid icy or very cold water. Don't break any blisters. Apply moisturizer, okay, over the area like aloe vera. Keep the burnt person out of sunlight. Have the burnt person take ibuprofen, pain reliever. This is a painkiller. No, if ever hindi siya allergy, because there are some individuals as allergies of ibuprofen and acetaminophen. So consult first your doctor or ask kung anong allergy ng individual, ng person. If it's a major burn, do not apply any ointment, okay, or anything. Do not. Just cover wound with loose materials lang. Huwag mo naman din i-tight, no? To prevent contaminants from infection, to prevent infection talaga, huwag masyadong tight. Okay? Yan. Next. Okay. Ano naman tong 8? It's an allergic reaction. What are those allergic reactions? I know, karelate kayo nito kasi no, sa dinami-namin ng mga allergic reactions that you had, no, when your body is hypersensitive to a foreign substance, no? Maraming klase yung foreign substance. Pwede to, skin contact, poison plants, no? Punta ka sa bundok, ayan, mga poison animal, scratches, pollen, no? Latex sa gloves, yung gloves natin, nakaka-allergy yan. Bee sting, nakagat kayo, or medication, nainom, may allergy kayo sa certain medication, or sa food, nuts and shellfish, no, mga seafoods. Then you have, na-inhale mo yung pollen, kasi, no, during, no, sa US yan, during yung mga, namumulaklak yung yan, may allergies. No, I have a friend na allergies sa pollen, ICU talaga siya during yung mamumulaklak, anong season yan, dust, mold, and, no, mildew, animal dander. Yan yung mga source of allergies natin. Okay? So have the person lie on their back. What you will do, keep the person calm. Okay? Kasi ang pinaka na symptoms nitong allergy is hirap huminga. Okay lang yan, kate-kate, no problem. But if that person complains na of difficulty in breathing, that's dangerous na talaga yan. Dangerous na yan, so you need to rush that person to a hospital or call for help so that it can be given medication, epinephrine, no? Lie on their back, keep their feet elevated, 12 inches. Okay? Make sure the person's clothing is loose so they're able to breathe. Avoid giving them food, drink, or medicine. Huwag mong bigyan. If appropriate, learn how to inject at epinephrine. So, sa US kasi part yan o sa ibang developed countries, tinitrain sila on how to give mga, antihypertensive medications, no? Okay. Wait 5 to 15 minutes after using the medication. If the allergic reaction isn't subdued, a second dose may be required. So, siguro naman by this time, may help na. May help na kayong, dumating. Yan. 9. What's number 9? Treating fractures. Kanina sprain pa lang. So, hindi yun fracture, ha? Na-strain lang yung mga ligaments. So, it's not really a bone, no? Dito, talagang fractured talaga. Tingnan mo yung mga there are different types of fracture. It's here. Yung simple lang siya, bale. Ayan, compound. Maghiwalay. Ayan, green stick. Ano lang, sa mga child tong green stick, malikot si baby. Ayan. Comminuted talagang, daganan to, ng 10-wheeler crack, na-impacted. Masakit to So, yung pinaka-painful, na-impacted. Yan, may mga nerve endings na na-ipit. Ito yung impacted. Okay? So, don't try to straighten a fractured rib. So, wag mo siyang i-straighten. Use a splint or padding to stabilize the area and keep it from moving. So, kung gusto nyo ma-train ng first aid, part yan ng training, mga splints, paano gamitin, sa first aid. Ayun na. Apply a cold pack to the area. Don't apply it directly to the skin. Wrap it in a cloth or put in a plastic bag. Keep the area elevated if possible. Give the person an anti-inflammatory drug like ibuprofen. So ito talaga also dun ibuprofen. For the lots of Filipinos who are allergic to ibuprofen. So ask first kung yan, makapagsalita pa yung victim, ask kung may allergy. Baka you're adding, so number 2 na feast, adding insult to injury, So you need to check. Or number 10, so ito na, if you're trained, you can perform CPR, It's a life-saving technique that's useful in many emergencies, such as heart attack or near drowning, in which someone's breathing or heartbeat has stopped. Ayan. So, ayan na yun. If you hindi ko na masyadong i-discuss to because we are not on the skills, Basta may mga steps. Oh my God. Sorry. Grabe yung, dito, lightning, thunder, ano ba yan? Shake, Ayan, mga steps yan in CPR. So dapat kasi yung guide talaga natin sa American Heart Association, it's CDC, yan, para legit talaga yung source. And then I have here included first aid. Kasi sa CPR, may mouth-to-mouth tayo eh. But here, during the pandemic, no, hindi ka pwedeng, no, you can do CPR, compression lang siya without the mouth-to-mouth. Ayan, kasi yung mode of transmission, see, the SARS-CoV, droplet, medyo malayo. Airborne, medyo malayo. More than, 3 meters. Droplet, malapit. Less than 3. Yan. Or contacts, contaminants. Hawak niyang doorknob, nawakan mo rin. Ayan. O toilet seat or whatever. Ayan. Kaya be careful. Okay? So, ayan. So, before you can do CPR, sa mga may COVID, you need to have protection. Sorry, naririnig ba? Okay pa? Am I good? Nadi-disturb ako sa thunder.
Yes,
I'm still good.
You're still, yes.
Yeah. Sumisigaw na ako dito kasi ang lakas ng ulan. Okay? So, we have here the level 1, level 2, level 3. So, each kung layman's ka lang, pwede mong level 1 lang ginagamit mo na PPE. Yung mga leveling yan eh. So, soon, if you want to be trained, so mas specific pa yung gagawin natin dyan kay skills. We taught this to our students, but since it's just a awareness that during COVID ngayon na pandemic, di basta-bastang wala kang gagamitin yan before, it's part of your preparation. Dapat may gloves, dapat may mask, na gagamitin, So, it should be part of your bag na mayroon kang extra dyan na dalhin mo lagi. Ako nagdadala lagi ng extra mask, ng gloves. Anytime, pwede kang, during emergencies. Yan. Ayan yung CPR, adult CPR. Ayan. So, wala siyang mouth-to-mouth resuscitation. Just compression. This is from the American Heart Association. Okay? So, of course, yung first aid kit natin, importante yan. Ayan. So, anong laman ng first aid kit nyo? Dapat i-check nyo yan. You can Google all the important, you can Google, meron din akong dito, i-share ko sa inyo yung legit na source, na website, na URL, kung saan yung anong klaseng first aid kit yung kailangan nyo, Kasi depende yan eh, kung sino ang gagamit. Okay? Ayan. Ayan, rescuer protection, kailangan ng gloves yan, must have items in your real first aid kit. Ayan, kung you're expecting for shock, anong kailangan? For burns, anong kailangan? Fracture, anong kailangan? Then wound care, may bleeding, anong kailangan? Ayan, I'll have to share it with you. I will just send it through email sa sa akin, yung coordinator niyo. Okay. Okay, so this is a law, the law, minention to ni Sir Seno kanina, yung RA number 11058. So this is an act strengthening compliance with the occupational, sabi niya kasi diba during the Yolanda, if yung Republic Act na to, so lahat andun na sa wala na ngayon, because it's an act strengthening compliance with occupational safety and health standards and providing penalties for violation. So any violation, managot ka sa batas. So the right to safety and health at work shall be guaranteed. Dapat safe. So all workers shall be appropriately informed by the employer about all types of hazards in the workplace. That's why it's very significant na meron tayo ganit webinar na to so that you will know about the hazards here. Para yung hazards na yan hindi maging disaster. Yung hazards or an event, a situation na hindi magiging disaster. Provide access to training and education on the chemical safety, electrical safety, mechanical safety, and ergonomical safety. Ayan. So we are protected by this law. So kung hindi kayo, soon to be, you will be, hindi kayo aware niyan, hindi kayo, hindi kayo inform, pwede niyong kasuhan kung saan kayo na organization, saan kayo na company, kasi it's for Republic Act 11058. Okay? More of that, I will share with you yung ano talaga, no? Yung RA na yan. Or you can Google. And we also have what we call, sinainan to ni ano sa Philippines, sa Canada kasi to. Tapos dito sa Philippines, si Senator Gordon, siya kasi yung sa Red Cross, sa Philippine Red Cross, siya yung nagpapasa nito ng law. The Good Samaritan Act is a law which protects any volunteer like you. So you will become volunteers. Alam nyo na kung ano lang yung kaya nyo at anong hindi nyo pwedeng gawin. Okay? So that you should know, no, kung saan lang yung limit nyo as volunteers. You are called as, no, volunteers and not first aider. Okay? Kasi wala pa kayong training. But if you have already no, a certification that you are trained on first aid, then you're a first aider, no? Volunteer giving aid, kasi sabi dito volunteer, giving aid to an injured person in emergency situation. So the Good Samaritan rule states that someone that comes to the aid of someone else is imminent danger pero cannot be sued. Hindi ka pwedeng makulong for wrongdoing or incorrect practices. Provided, may mga provisions to ha, so you have to read the whole, no, this Good Samaritan Act or the law itself. Kasi may mga provisions yan. This encourages people to act and not stand on the sidelines for fear of persecution. You cannot be sued for accidentally administering incorrect CPR. So may mga provisions yan, mahaba yan. So you have to read the whole thing. Okay? Kasi baka, no? Disclaimer lang. Baka yung konti lang yung naano nyo. Okay? With that, ladies and gentlemen, so ito lang. Inano ko lang yung sa Australia Training Institute. Maganda tong, you can read it everywhere. Be a hero. You can do that. Save lives. First aid is for everyone. Same way as your disaster, sabi ni Sir, I'd like to quote ni Sir Seno kanina na sinabi niya yung DRRM, no? No, hindi yan para sa ano lang, sa mga offices, sa DRRM service. It's for everyone. Same way yung first aid, we can help, no? Be a hero, save lives, no? It's for everyone, everywhere. With that, thank you so much. On behalf of the College of Nursing, I'm Phoebe Lynn Calungsod. Thank you. If you have questions, you can ask now. Or ano ba, ma'am? Or Miss MC?
Okay.
Kasi mag-alas 12 na eh.
Thank you very much, ma'am.
Okay.
Oo nga po. Okay, thank you very much again, ma'am.
I hope you learned something from me.
Informative.
Okay.
So, hopefully, may natutunan din yung
Hello? Nawala yata ako. Hello? Nandyan pa ba ako, sir? Sino ba to, sir?
Yes, ma'am. Nandyan.
Okay. Kasi nawala si Ma'am Erna or ako ba nawala? So, may tanong? May mga tanong.
Sir Marlon?
yes.
Okay, ma'am.
So,
Or we can ask questions later. Mag-lunch. Ay, naku, hindi ko maintindihan si Ma'am Erna. Or ako ang yung may problema.
So, isa sa mga natutunan natin, di ba, yung itinuro sa atin guys, kung at saka yung
Sir Marlon?
Yes, ma'am. Can you hear me, ma'am?
Yes. Nawala si Ma'am Erna. Or ako ba yung nawala? In-off ko yung camera ko. Maybe
Parang
it's because of
internet
my
yata niya,
camera.
ma'am.
Yeah.
Okay, may tanong dito, ma'am. Ano daw ang dapat gawin or first aid kung natuklaw ng ahas or kagat ng aso?
Okay. So, kagat ng aso. First and foremost, no? So, una tayo sa ahas, no? So, here sa Philippines kasi may iba-ibang klaseng ahas, di ba? So, you have to determine kung anong klaseng ahas kasi may mga poisonous yun, yung mga ano ng ahas. Meron ding, depende sa location. Kasi, so pag can you hear me well? May naririnig ako. Is it myself? Sir, can you hear me?
Yes, ma'am. Yes, ma'am.
Kasi may
I
naririnig
can
akong,
hear you, ma'am.
may ingay. Is it my microphone?
Am I audible?
Sorry. Yan, pag-ahas. Ahas talaga ang tanong. Yan. So, pag-ahas, no? Di ba sabi nila na...
Yes, ma'am.
Pag yung... Depende kasi sa ang area ng kinagat ng ahas. Pag near, sa is may connection. But if near sa brain,
Pero naririnig ka namin, ma'am.
but near sa brain, yung kagat ng ahas, no? That's very dangerous. Okay lang kung sa extremities yung malayo na part sa body. But if malapit sa brain, same with dog bite, kung malapit siya sa brain, dapat no, dalhin na kaagad, no? Seek for medical help ASAP, no? So kung first aid niyan, no, sa ahas kasi, 'di ba, yung ginagawa dati, yung nilalagyan ng tourniquet. Tourniquet means kung hindi makita yung camera ko. For example, kung dito yung kagat, hindi naman dito nilagyan ng tourniquet. Dito, no? Kasi sabi nila yung venom daw papunta doon sa extremity papunta sa brain, no? But be careful in doing so kasi baka masyadong matagal yung paglagay mo ng tourniquet until that time nag-seek ka ng medical help. Baka patay na yung ano niyan diyan, no? Mga tissues, no? Kasi sa sobrang higpit ng ginawa mo. So might as well no, if ganyan, pag malapit sa brain yung kagat, no? Huwag naman dito sa liig yung kagat, lagyan mo ng tourniquet, no? Mamamatay talaga yan, no? Diretso ka agad. You can wash man soap and water, same with dog bites, no? And then soap and water lang. Tapos diretso ka agad sa hospital pag malapit sa brain. Okay, yung kagat. Other than that, huwag niyong lagyan ng bawang. No? It's a no-no. Lagyan sa medical field, it's a no-no that to put bawang, ahos. Okay, dukdukan ahos.
Yeah, totoo yun, ma'am. Yung iba,
yes.
ahos yung ano.
Yes, because my lolo also is kanang mangsuna before, na napaakan akong manghod, no? Ibutang ahos. Well, it's your belief to do that, but since I am on a medical field, I'm a nurse, bawal yan, no? Kasi maybe yung ahos na yan, may dala yung microorganism, baka yun pang dahilan, ma-infect yung sugat. Yun yung reason. Okay? I hope I was able to answer your question.
Yes, ma'am. Yes, ma'am. Thank you. And my another question, sir, ma'am, from Team Harmony, Kabia Kyle. Tanong niya, ma'am, what is the proper first aid response for an untrained person to an exposed broken bone fracture?
Okay, so untrained person. Sabi ng lecture ko kanina, pag you're suspecting for a fracture, no, tapos untrained ka po, so just stay with the victim, call for help. Yan talaga ang gagawin. Huwag mong galawin if you're suspecting, especially if it's a spinal cord injury dito, spine, yan. Ito kasi yung spinal cord natin, sa spinal column natin, nandyan yung natin, no? Delikado yan. Pag once na yan yung spinal cord natin, baka ma-paralyze ka no? So dapat wag galawin. Stay put lang, then call for help. Okay. Pero kung extremities, ayan kasi kailangan i-train ka kasi paano yung pag-splint. Kasi depende kung saang part, anong klaseng bone. So you need to be trained yan sa skills. So maganda yan soon pag mag face-to-face tayo, no? Kasi mahirap i-demonstrate ito online. Okay? So all you have to do kung ganyan, di ka train, be safe. Baka mamaya makulong ka, no? Okay. Not unless CPR kasi 'di ba? Sabi doon sa CPR, airway breathing, yan. Talagang pasok yan sa Good Samaritan law. Okay? Yung fracture lang, pwede makahinga pa naman yung patient, hindi rin immediate talaga na emergency talaga. Not unless grabe yung bleeding. Okay? Yan. I hope I was able to answer more questions.
Okay, other question from Rob Eugene, viewer from the FB Live. Totoo bang hindi pwede iinom ng tubig pag nakagat ng ahas, ma'am?
Walang medical, I'm so sorry, sino yung nagtanong? Walang mga myths. Yan, may mga myths kasi yan eh. Walang scientific basis. Some of those myths, yung mga beliefs ng yung mga faith healer and all, no? So walang mga scientific basis ng mga ganyan, sir. But bakit daw bawal inom ng tubig? Baka pupunta doon yung venom papunta sa body? Hindi ko alam anong reason but bawal inom. Or baka
Okay.
ihanda for operation or surgery. Bawal uminom nga. Depende kasi. Yan. Di natin nakuha kung anong reason bakit bawal uminom. Okay?
Okay, questions from Adrian Alicer. Permanent po ba kung meron allergy sa seafoods?
Ano ibig sabihin ng permanent? All throughout, no? His life or her life, na allergy ka ng seafoods, allergy ka forever. For some kasi nade-develop sila ng minsan nawawala, no? So nawawala yung pag-sensitive ng food. Kasi lalo na ngayon, you have antihistamine, inom ka muna tapos no, kakain ka ng seafoods. But some all throughout, kasi meron akong kaibigan na dati may akong close friend, dati allergy siya ng seafoods. But anong nangyari, no? At her mga 30s, nawala yung allergy niya, no? Mga ganyan. So depende, but most likely mga 90% hindi yan mawawala. Pag allergy ka talaga ng seafoods, allergy all throughout. Nasa mo yan eh, nasa system mo yan, nasa katawan mo yan.
Okay, wala na kayong tanong from the viewers from FB and
ay, mayroong tanong dito sa
meron.
Ang haba.
Sa Zoom.
Ano po first aid at ang inatake ng okay, first aid ng inatake ng advance. Inatake ng high blood. Ayan, anong nangyari? Anong inatake ng high blood? Depende kasi yung description mo ng high blood. Na twist ba yung mukha, ano ba yung BP mo. First and foremost, you check kung huminga pa yan yung patient, yung victim. Then if you have BP apparatus, you check if it's really high blood yung dahilan. So marami kasing ng high blood. Okay? Yan kasi ayan mama ko po kasi pass away at 56. Hypertensive po yung meds at tinitik. Sabi po ng kasama niya sa bahay, bigla lang daw po nahilo at bumagsak si mama habang naglalaba. Then nung binuhat at pinaupo, nag-lockjaw na po at nung dinala sa hospital, nakagat daw dila niya. Then dead on arrival na po. Kung naagapan po ba ng tamang first aid? Yes, of course. Kung may alam yung member ng family how to save, how to do the first aid, baka may chance pa. Do CPR right away. If ayaw nang wala nang, di ba, check for the breathing. No? Check for the pulse. Mayroon na yung step ng CPR. Yun. Una, no? Check. Hey, ma, di ba? Pukawa o sampita. If di mo tubag, hiwi. That is not lockjaw. Nahiwi na siguro ang baba. No? Atake na. No? Kaya atake mag-high blood. No? Kung wala na pulse, kung mo sa imong baba here, wala na nagginhawa, do the CPR right away. No? Give blow, naman tuloy ka ng steps. So, muna siya. If kabalo, no? If na meds natin, sinabi ko kasama if yon alam nung isang member ng kasambahay how to do it, then baka kasi, but less than, no? It should be less than, no? Dapat dalhin na 5 minutes papuntang hospital. Kasi brain dead na yan eh. Pag more than na dyan. No? Diretso ka agad. Kung malayong hospital, that's delikado. Okay? Yan, salamat mami in advance. May tama po bang first aid sa sarili kung biglang nahilo bago po bumagsak? Yan, may tama ba daw ang first aid? Biglang nahilo bago. Pag nahilo na, then sit down. So you also have to tell the family member, pag may naramdaman na, tigil na, no? Huwag kumpiyansa, no? Maupo, mahiga, and then observe. Kung huminga, yun talaga una, humihinga pa ba? May pulso pa ba? You know how to get your pulse rate? You know how to get your pulse rate here? Yan talaga, yung determinant kung okay pa ba yung circulation, breathing ng ano niyo, members of the family. Yan. Or kung mayroon kayong BP, take the BP. Okay. Yan. Vital signs. That's vital signs. Okay. I hope was able to answer. Meron pa ba?
Yes, ma'am.
Do we have certifiable training for... Yes, Sir Marlon, di ba nag-ano kayo? Kasi yung fourth year namin ngayon, they were trained in first aid before. During their second year yata yun. Was it an STP or was it sa RO?
ROTC, ma'am. Yes.
Yeah, I
ROTC.
saw them. I saw the pictures. And we also have yung sa nursing, sa College of Nursing, meron kaming partner. We have ongoing MOA with Red Cross Silongos. So we train, and our students will be trained during their second year before they will go on duty. That's part, no? Dapat yung yung competence nila. Okay? But if you want, lahat yun, Sir Marlon, no? Hindi lang yung nursing students. Kung gusto nyong ma-train, pwede yun sa ROTC.
Specific for nursing lang, ma'am. So,
nursing lang yun?
Yes.
Okay.
Medical platoon yun, ma'am.
Medical platoon yun sila yung mga students namin na fourth year na ngayon. Yeah.
Yes,
ayan. So hopefully face-to-face, kung gusto nyo, it's very important. No? Lalo na pag member ng family nyo, may mga matatanda, may mga PWD, kailangan talaga yan. Eyes problem, wait. Eye strain daw, tapos maligo agad. Using your phone too much and take a bath without resting the eye. Mga eye strain. So, papahinga muna yung mata bago mo babasain, no? Kasi syempre, 'di ba? Same yung mga mo diyan, mga blood vessels, mga mo diyan, masyado pang nakadilate kasi nakafocus ka diyan sa computer mo, sa cellphone mo. Just take a look yung 2020 na yan. Tingin ka muna yung mga green, yung mga something green sa malayo, no? Yan. Before ka maligo. Yan. Same lang yan kung pasma-pasma, may syempre, no? Magkuan-kuan pa imong kuan dito. Init ba yan na atong mga kuan, no? If nagamit jud siya, okay? Press muna. Okay, more questions. Salamat.
I think, ma'am, my question from Inji.
Mm-hmm.
What is better, do CPR without proper training to someone who drowned or do nothing lang?
May siguro may experience to. Do CPR without proper training to some who drown. If really it's an emergency, a matter of life and death, and you are not trained, no? You are not trained pero alam mo paano, better try how to do it. Kasi 'di ba sabi you are, no? Sa Good Samaritan law, no? You can do that one. But without further, kung drowning lang man, ano mang ginawa mo? CPR lang? Giving air? O kung giving air lang, why not try? Or you did compression. Pero hindi mo alam paano compression, baka maka-fracture ka. So better not do it. No, if you're not confident to do the CPR, like chest compression, baka maka-promote ka ng lalo na pagbata. Tapos mabigat yung kamay mo, hindi tama yung paggawa mo. Adding insult, that's number 2P. So don't do that. Pero pag nag-blow ka lang sa bibig mo, bigyan mo siya ng air kasi ay nang huminga, it's okay. Blow lang eh. Pero pag ganyan, no? Pag ma-fracture, wag. Delikado yan. Yan. God's bless. Okay, wala na yata. Just want to confirm. Okay. Mas maganda dahil pag may training ka talaga. Okay? John
Okay.
Kyle, okay?
Okay, ma'am. Question from FB viewers.
Mhm.
My first aid po ba for vertigo, ma'am?
Vertigo. Yung na ano, hilo talaga. Eh di magstay para wag mahilo. Anong cause ng hilo? Ng vertigo? Is it yung ikaw ang umiikot o yung ceiling mo ang umiikot? May ibang-ibang klase kasi yan eh. Kasi pag maganyan na head yung problem, you need to seek consult talaga kasi yung vertigo is just a symptom. May mga underlying cause yan. So hindi ko masasabi kung ano ang first aid not unless I know what is the cause, and I am here not really as a physician or a doctor who can speak what's vertigo all about. Ang alam ko pag vertigo, yun. It's either ikaw ang umiikot o yung sa paligid mo yung umiikot, tapos i-check yan yung vital signs mo kung ano yung cause before we can really say that what really the first aid for that. Hindi kasi it's a symptoms just like fever. Kasi marami naman pag fever, marami yan. It's either infection, it's either or pain. Maraming maraming cause para makadiagnose ka kung ano. But on our level as a nurse, yun lang, sa mga symptoms lang. So you really need to go to a doctor. Lalo na pag ganyan, vertigo. Okay? May mga limitations. Okay? Thank you. I hope kung matagal na yung vertigo mo, you need to really seek consult. Kasi may sinasabi tayong mga, lalo na pag triad of symptoms, it's not only vertigo, may vomiting ka, may problem ka sa balance. Yan. So you really need to seek consult. Huwag mong pabayaan yan. Pamamaya, may mga tsumo-tsumo na yan dyan sa utak mo. No, kaya it's a symptom, it's a sign. Yan, ang vertigo. Okay? Just more questions, sir?
Wala na so far. May matanong pa kayo dyan? Just raise lang sa Zoom.
Okay, you can message or you can PM me. You know my name. Diba? Kung maroon pang questions, o ipadaan nyo lang kay Sir Marlon. Sir Marlon na mag-email sa akin.
Okay, ma'am. No problem.
You will ask
Ma'am,
for my
malahas.
slides, sir? O you will ask for my slides?
Yes, ma'am. If pwede.
Yes, later. Sige, sir.
Okay.
Ayusin ko lang. Nakaano lang naman to Google Slides. So I can share the link.
Okay. Thank you kaayo, ma'am, for
Okay,
that.
welcome.
And thank you very much, students, for raising your questions and for your participation as well. So, as of the moment, since we don't have enough time to continue with our third third topic supposedly for this webinar series, so we will continue it next meeting. So as of the moment, we would like to express our appreciation and gratitude to our guest speakers for this morning. So may we have our CWTS coordinator to award our certificates, sir, Professor Joy.
Okay, so good morning. May unto na day. Dahon salamat for staying with us until this time. No? Okay, so in behalf of Civic Welfare Training Service, we would like to award the certificate to you, ma'am. The citation reads, this certificate is proudly presented to Professor Phoebe Lynn Calungsod for the invaluable time, expertise, and service rendered resource person with the topic First Aid in relation to DRRM, given this 30th day of October 2021 at BSU during the CWTS webinar series via Zoom and FB Live. Signed, me as the coordinator and Professor Manolo Loreto, our Director of the English TV Office. Alright, thank you very much, Ma'am Calungsod. The same
Joy.
Same certificate also was given to Dr. Seno for the topic of types of hazard in the Philippines. Alright. Thank you very much, ma'am.
You're welcome. Thank you po, Sir Joy.
Thank you very much, Sir Joy, for the certificates. And also, thank you again, Ma'am and Sir Seno, So, for sharing your expertise and for your time. What we've heard and learned today are beneficial to all of us. So, we are honored and privileged to have you with us in our webinar series for this morning. So, thank you very much also for the students who stayed and naminaw paghihapon hatod karon even though naabto na taog paniud to. So now I know we're all excited for this part. So allow me to welcome our CWTS coordinator again, Professor Joy Billian, for the closing remarks. Sir?
All right. So once again, my motto, we always say this. Thank you very much for staying with us. No? We hope, as a part of CWTS, we impart this practical knowledge for you so that we become equipped with the skills in relation to disaster risk management. All right. So we'd like also to express our gratitude to our speakers, si Dr. Seno and then si Professor Calungsod. Thank you for sharing with us your expertise. This surely is a comprehensive discussion on DRRM. And I know, I'm very sure, ako in my case, I'm interested to learn more on first aid. I was asking earlier kung doon na ba siya certificables training so that we can also be certified. And then, especially in our case, we are here in STP, perhaps we can also share what, we can be qualified first aider. So that's it. We're looking forward later on. Hopefully, we can organize a training on that relation to first aid. All right. Another topic, we're supposed on fire safety and earthquake drill, which we rescheduled on next week. Hopefully, students will be with us on this topic. And I think this is one of the relevant topics on fire safety because fire safety, I think earthquake safety also because these are things that naturally occurring to us. So this is again part on disaster risk and management. So thank you for our MC, si Ma'am Erna Alahas, our director, Professor Loreto, and our moderator, Marlon Dampius. And then we have our in charge for the ABP and others who have contributed a lot for this activity. With that, thank you very much and good noon. And I think I also have to take this opportunity to share our finale, Ma'am Erna.
Okay. Sige, sir.
Oh, ito nagdali na.
Loves a melody for our dear university, with fruitful fields and verdant lawns, with gorgeous sunsets and beautiful dawns, a school with a noble mission, from the sport to salvation, countless leaders of the nation. Messiah State University, to you will all be true. Our loyalty to you we pledge, as the many years come and go. Our dear